prices.
Regional health agencies in Quebec are asking public long-term care homes to create hot zones to accommodate COVID-19 patients who aren't residents in these facilities. But families worry that the move will lead to cross-contamination and more outbreaks in these homes, something they watched happen during the first wave.
I mean, it's not like Maimonides is so huge. I mean, it would take maybe 1/4 of a floor of the former hospital to be outfitted and just create a COVID ward there for old people. But to bring them to us is just, we couldn't even manage our own population the first time around.
Although public health says they're more prepared for the second wave, 40 Quebec long-term care homes, or CHSLDs, are seeing a spike in outbreaks. So-called SWAT teams are being deployed to 4 CHSLDs, struggling to contain the virus, including in the Montérégie region at CHSLD Sainte-Croix, reporting 37 cases and 13 deaths.
So 320 compared to 2,700. So it's almost 9 times less, 87% less of people affected comparing to the first wave. Is it perfect? I would like this to be 0. But in a virus that is so difficult to control, I think we've done a good job so far.
Maimonides Geriatric Center in Montreal's Côte-Saint-Luc is one of the long-term care homes setting up a hot zone. It's reporting no cases of COVID now, but saw 10% of its residents die last spring. They say that community members who are medically stable do not require hospitalization, but require a greater level of care than what is being offered at their current location will be taken care of there. The CIUS Centre-Ouest Montreal, in charge of Maimonides, confirmed to City News that COVID-positive individuals will not come into contact with uninfected residents. They will be put into designated hot zones that are separated by permanent walls from the other residents and the other units. They and the staff who care for them will also use designated elevators that will be unavailable to other residents and personnel.
If you have staff that work one day in the hot zone, one day in the cold zone, or one day in the red zone, one day in the green zone, that's going to be problematic.
But for Annetta Black and many other caregivers scarred by the lack of staff and care during the first wave, they worry this will only cause more outbreaks.
We don't have the assurance that there's the adequate staff to manage this. Did it really talk about all of the new safety measures that would be put in place?
In Montreal, Melina Jubilaro, City News.